Vivian Boaz, and this is the EHS Unplugged podcast, the show where we share tips on home and workplace safety, environmental sustainability, and health and wellness tips. Join us as we explore these topics with industry experts and learn to create a safer and healthier world.
In 2025, I mean, the year is coming to an end very soon. It's moving so fast.
Yeah.
But there's something you've mentioned about, failure or delays when it comes to releasing funds. So what exactly at the moment Dosh doing about that? As your department, what are you guys doing about that? If me as an employer, I am refusing to release funds that are meant to, help an injured employee, recover and resume work, or even if they don't resume work, to live a comfortable life. So what are you doing about that?
Thank you for this question, because it's very important for us, and even for injured workers. There has been a tendency, and it's very common, to delay compensation using all techniques in the book and out of the book. So we have to develop social skills. We have to develop social skills. So we talk to the employer in the first instance, and we tell them to look at the employee as one and part and parcel of this nation. Employees, or the injured employees, need to eat. They need to take their children to school. They need to take care of their basic needs of human beings: food, shelter, and clothing. So we talk to them, because social dialogue is part and parcel of the ministry's agenda. So we talk to them and we tell them all these facts. In the event that the delay continues, we now start talking to the employee. And we tell them that there are additional opportunities for resolving this matter. DOSH is not the final end. It's not at the tail end of resolving or arbitrating delayed payments for work injury compensation, or even refusing to pay. We are not the last one. We have the courts. And the main court that we have, where we work very closely together, is the Employment and Labor Relations Court. For a long time, when we realized that there were delays that we could not probably assign to ourselves, we said, if the employer refuses to do everything that we have said, or everything that we have talked about, including extension of time, then we refer the employee to court. And we refer them to and we have been doing that faithfully. And in these courts, what their advocates or their representatives need to do is just to request the Employment and Labor Relations Court or the judge to convert our demand for work injury payment as a court order. And once it becomes a court order, the people who want to refuse to obey court orders, they must face the wrath of the court. There is something called contempt of court. And the judges know what to do, because now that is their area.
Yeah.
So we have also tried to ensure that some people delay because the amount is so huge. And because we cannot leave the employee to suffer without even the ability to pay rent. We can sit with the employee. If he agrees, we sit with the employer also and agree on some, payments that are not necessarily lump sum. So we can, and we have done this before very successfully, where we agree with the employer that now that you don't have money, and sincerely you say, this is your bank account and this is how your sales are, we look at how can we make this payment possible within 1 year, within 2 years. So depending on the amount and depending on the agreement of the employee, because the employee has to agree. We are not going to get into this arrangement if the employee doesn't agree. So once the employee agrees with such arrangements, and the employees also understands that this employee is unable to pay because of this particular reason, and it is evident, and there is sufficient evidence to that extent, they sign off. We sign off this agreement, and then the employer will be paying either monthly, and we have said monthly is better, and we have been successful in a number of cases where monthly payments have been adhered to strictly. Of course, it is preceded by some lump sum, either half of the amount involved or a third or any amount that the employees are agreeable to. Yes.
I like that there's always room for dialogue, right? Because some employers, close themselves off, thinking that your docket, there's no room for dialogue. Once you say you're supposed to be paying 1 million, then that's it. So it's really good to know that. As you were talking, it came to my attention that the focus area is on those who are formally employed, right? But we have those in the informal sector, those who don't even have a contract, but they're still working in these workplaces. They're still exposed to all these harms, right? And they still get injured, some of them. Some of them actually die. So are they also covered?
Thank you so much. The Work Injury Benefits Act actually is, it applies to all workplaces. So it doesn't matter whether they are informal or formal. And the word informal is just informal. You can be called informal, but you are formal. If you have an ID and you are operating, you've already been formalized. As a Kenyan, you're already formalized. So what happens is that the only problem that we have are with what we call the self-employed persons. That's where the problem is. And that's where the majority of workers are. And this could be more than even 10 million. Because in the entire informal sector, we have more than 18 million workers. So maybe more than 10 could be self-employed. So the self-employed is where the problem is, because most of them are not insured. And they face great problems when they go to hospital. We thank God now that medical insurance is compulsory. And I seriously encourage self-employed persons to adhere to their monthly commitments to the Social Health Authority so that medically they can be covered. So in case of any injury, they can get immediate medical attention. Because without the ability to quickly access emergency medical attention as a result of an injury at work, it might deteriorate and the person might even die. So it is important that we encourage all the what we call the self-employed, those who are working alone. You're working, for example, as a mama mboka, you're one person. You're working as M-Pesa agent, you're one person in that facility. These are the people who are at most risk. They are at the greatest risk of losing their lives as a result of workplace injury. Because if you can't get access to immediately to medical attention, you're doomed. Yeah. So that's where the problem is. And that is where my vision of Workers' Compensation Fund comes in. In that vision, as I explained earlier, the issue of every employer will pool resources. So if you are a self-employed, you will also be part of the pooling of resources. In case you get injured, medical attention will be provided and the necessary compensations will be accessed. You might not access the full range of benefits, but you'll access the basic requirements for good health. Yeah.
I mean, I like that, but I'm still insisting on this because I think the way you envision this is if you're in a cooperative, if you're a group, then it's easy for you to access, enjoy the benefits that that WIBA has, for us. But for these people who are working as individuals, not really self-employed, I want you to look at a typical informal sector. You said informal is really not a thing because once you understand the operations of a business, But in reality, when you say informal, these are people outside of, the legal requirements, right? So how do we bring these people on board? If you mentioned Mama Mboga is an individual, right? But maybe Mama Mboga also has 2 employees that we are not aware of.
Okay.
In the trail of, getting mboga from Pale Kamukunji. It's Kamukunji, right? Or I think it's Kamukunji. So getting that mboga, using that truck to Mama Mboga in the morning, or they come at night. This is this Mama Mboga's employee. When this person gets hurt, what is the procedure?
Yes, so that is a very good question. The mere fact that you are an employee of a self-employed person in the informal sector doesn't exclude you from the work injury benefits coverage. So all those ones are covered under the Work Injury Benefits Act. And the only problem is that these workers, I would say they remain unknown in quotes. They are not known to anybody except their self-employed employer. The second thing is that sometimes there is low awareness. In most cases, there is low awareness about what next after an injury. So they don't know what to do.
Exactly.
So the employee doesn't know what to do, and even the Mama Mboga employer does not know what to do. But should these injuries find themselves in the reporting system that we have, either it has been reported to our offices anywhere within the country, or it is reported to our DOSHMIS, which is our online system, I can assure you they will be paid. The compensation process will kick off immediately. And that's why it's also important to informal Kenyans that if somebody is injured in the course of employment, any person, including yourself who is witnessing, can report this to the Directorate of Occupational Safety and Health Services. Any person. It doesn't matter. You don't have to be an employer. You can, even your spouse can report or can ensure that this report reaches the Directorate of Occupational Safety and Health Services in the country. And now we thank God we have officers in all the 47 counties.
I know, baby, congratulations. That was huge. That was huge.
Yes. Yeah, it's through the good work that our secretary is doing, Dr. Musa Nyandusi. We're able to deploy 121 new officers in March last month to all the 47 counties. So, and we are moving towards ensuring that more officers are also employed. That's not the end. We'll just ensure that we are present in all the 47 counties. So any person should be able to report any injury to the Directorate of Occupational Safety and Health Services. And it will reach us.
I like that because we are, this month, the World Day for Safety and Health at Work. Most people don't know that, but it's on the 28th, right? And the focus is on, digitization, AI. And Dosh already is doing so much, in that area. One of the things you've mentioned is the Dosh maze, right?
Yes.
Now, is it possible for me to report an injury in the workplace? Even you mentioned that even if you see it as a citizen, right? You can actually report. So can I do it myself through the Dosh maze?
Yes.
Tell us about that, because that is a very...
I don't know whether you want me to demonstrate, but if you open Doshmis, on the dashboard and on the right side of the dashboard, we have a place called File Complaint. Any person can file a complaint in Kenya. You can also upload a photo under that File Complaint module. That File Complaint is accessible to all Kenyans. I'm sure even non-Kenyans.
Is it for non-Kenyans?
Yeah, you can file a complaint.
Okay.
And action will be taken. So when you file a complaint, the DOSHMI system automatically assigns an officer to take action, especially the officer in that particular county where you have filed the complaint from or about. So the filed complaint also allows injured employees whose employers have refused to report or to notify the director of accident to do so. So the employee can do it by themselves. And then immediately after that, the work injury compensation process will kick off. Yeah.
I mean, I really like that, because so many cases are going unreported, and we're having so many injured Kenyans at home. They're injured, they're not able to go back to work, there's no source of income. So you can imagine the lives these people are leading, right? So that's really a big milestone on your part.
Thank you.
I wanted to, now let's bring in the OSH professionals, because previously, before you opened it up to the public, it was the OSH professionals to do the reporting in most of the cases, because they work in these workplaces, right? So how can we help you and in implementing WIBA? How can we make your work easier?
Excellent. So, the good thing is that where OSH professionals are, in all the workplaces where they are, quite a number of them are knowledgeable, and quite a number of them are doing the right thing. They know what to do. They know how to relate with the directorate, and they know what needs to be done immediately an accident occurs. So number one thing that OSH professionals must do as a basic requirement, let them cultivate the culture of safety in the workplaces. When you have a culture of safety, it is very easy for people to report two important things that happen in the workplace. Number one is a hazard. Anything that can cause harm cited by the employees, they can easily report to management, and management would be able to take immediate action to deal with it. Secondly, reporting of injuries. So immediately an injury occurs and you have a robust safety culture, then the employees will be able to report those injuries as required by law. So once reported, the most important function of an OSH professional is supposed to be thorough investigation of that incident. So when DOSH comes, when they will, then the accident report is ready and available. We go to several places to look at or to do inquiries as a result of a workplace accident. And you ask the OSH professional, where is the report? And they don't have. They don't have. And yet the injury has been reported. So what is the purpose of such an OSH profession? Those are professionals who cannot help the workplace or the enterprise. And that's why the second point is that they should also develop the capacity to integrate OSH into the business processes. The leadership or the owners of businesses, they are in simple business. I do this business, I make profit. That is their work. If you are lucky to be blessed with a job as an OSH professional, you should be able to assist the business owners to integrate occupational safety and health into the business. So that when you are reporting to DOSH any injury, they don't see you as somebody reporting that organization.
As an enemy.
Yes. If you are going to visit the nearest DOSH office, they're not seeing you as going to report the bad things that they are doing in that workplace. So you need to make sure that you work with the business owners. You must understand business. You know, if you're working in a manufacturing sector, for example, as an OSH professional, you must understand that business to be able to contribute to the success of the business. And my third point is to ensure that you leverage on data. As an OSH professional, you must record what we call the leading indicators and the lagging indicators. And you must be able to calculate, for the sake of the business, things like injury severity rate, okay, fatal case rate. Simple things that will tell the business owner that this is how the business is losing or gaining from my being present in this organization. So you must be able to collect data. The business owner's work is not to collect data for you. You collect the data and ensure that you're able to share this data with the business owners. And something I realize is that there are some people who have data, but they don't have the communication skills to deliver this data to the, to the enterprise. So it's important for OSH professionals to take their time and go and study communication. 98% of human relationships fail because of poor communication. We can't communicate. You have the data, but you don't know what to say about it. And you know, you cannot give the business owner information. Give them what they can act on. You cannot tell them that I've calculated the severity rate is 1.16, and then you don't tell them what this means and what they are expected to do. So you must sit in a class of communication and learn how to communicate, what to communicate. You know, in the industry, we have different levels. We have the top leadership, the owners, the board directors. Okay? The information you give them is not the same as the information that you give or share with the shop floor workers. Totally different. And with your peers, your managers, those who manage safety in the workplace. So the information you share must be totally different. So you must learn how to package information and share it. And most importantly, occupational safety and health professionals must be able to receive feedback. I have worked as a safety and health manager. And one of the things that some people used to tell me is that we kazi yako ni kutembeaga tu hapa. Naonaga tu unatembea tu hapa.
Polisi. They call us policemen.
Yeah.
Police.
So
Policewoman, yeah. Policewoman.
Yes.
Yeah.
Yes. So what was I supposed to do after that? After gathering that feedback, I go to the next level of developing in-house collaboration. and building the capacity of myself, trying to recreate myself in every department. That even if I don't have to come to your department, I am present there. Okay? So I disperse safety and health information to my colleagues and my peers and the entire organization. And based on that, based on the fact that you're able to reach out to everyone in the organization and in all departments, and they're able to buy in. And after buying in, they lead that work for you. If you work in a place where we have 4,000 workers, you might not see them every day. You might not reach them every day. But your impact as an OSH professional through the communication and feedback mechanisms that you have developed, and through the process of acquiring allies and ambassadors. Some people call them champions.
Safety champions.
Yes, you must be able to be there to develop those champions. And they must buy your idea. You know, if you train about 100 people, 30% can be perfect champions. That's about 300, isn't it? So, I don't know, 30 for 100. So 30 people is a huge number. And you must be able to develop your leadership skills so that you're able to influence these 30, to influence other 30, and then the safety culture spreads within the workplace. That's the only way you, an OSH professional, is able to assist DOSH. Of course, your main focus will be on two areas. Number one is to ensure that the workplace complies with legislation. How will they do this? Number one, you must be able to avail that legislation to that particular workplace, all of it, because you are a professional. And number two, you must teach them how to comply. They must know how to comply. I know we are required to have trained first aiders. How do we ensure that we comply with this requirement? It is the OSH professional to do that and to ensure that effortlessly the workplace is able to comply with those requirements. If it is chemical safety, you are supposed to ensure that all chemical substances are labeled. How are you supposed to ensure that? So you, as an OSH professional, you are supposed to bring all the laws, starting with the Constitution of Kenya, the Occupational Safety and Health Act, and all the subsidiary legislation. Okay? And then we also have the Work Injury Benefits Act. And we also have other laws that augment. They have some provisions for occupational safety and health. You must be able to understand this. You must be able to look at the environmental laws and identify which ones are or have some provisions on occupational safety and health. Things like ASEA, okay, environmental audit. They have huge provisions for occupational safety and health, including the requirements for PPEs in construction environments, in high-rise buildings, and so on and so forth. So all these laws on occupational safety and health, you must be able to gather all of them, put them in place, and translate them into what can be actioned by the employer. You must. If, for example, there is a provision for designated health practitioners, they are required to examine workers in hazardous work environments. You should be able to conduct risk assessments in your workplace and confirm whether you are dealing with a high risk activity or a low risk. So if you're an OSH professional, it will be good for you and good for DOSH if you knew how to conduct risk assessments. If you don't know, school. Go to school. There is no other option.
I mean, how did you get to that position in the first place if you don't know how to do a risk assessment?
Of course, some people get it through internal promotion. Somebody was doing security work here, and then all of a sudden they become lucky enough to get a safety. So, some people don't know the difference between safety and security completely. They don't understand. So anasema, we ni mtu ya security, fanya hata hiyo ya safety hapo. Hata hiyo ya safety unajua. So the safety, that kind of person, the only safety they know is the safety of equipment in the office, so that nobody steals them. So they are just still going back to security.
Daktari, one of the things you've mentioned is, OSH being looked at as an afterthought in the workplace. In Kenya as a whole, let's just be honest.
Yeah.
But OSH is actually beneficial for society and businesses.
Yeah.
And it's contributing to our economy in a very big way. If you look at Vision 2030, one of the things they touch on is OSH, investing in the people, investing in, improved working conditions is contributing to the growth of our economy. But people don't look at it like that. So what should we do as a society? What's the way forward for us?
Great. So let me start from scientific evidence. Right now, as we speak, there are several countries, there are several organizations, and there are several universities which have conducted research into the contribution of OSH to national development and to the profit margin. And several studies point to the fact that investing $1 in occupational safety and health yields up to $8. Yeah, so there is one thing that we must do immediately. We must translate this into easy language, business language, that we are not spending on OSH. We're actually investing on OSH. Ensuring that you have a safe workplace is an investment to the bottom line. It is contributing directly to the profits. So we should be able to see this as OSH professionals and then translate it to business owners and then to employees. So we have a huge task of supplying information. OSH professionals must be able to put information together, work with marketing teams and communication experts to be able to translate this into something that is understandable at all levels. So the issue of creating awareness is not going to end soon. The low awareness that I talked to you about is a research that was conducted in this country. And the research was supported by the National Council for Occupational Safety and Health. And that research focused on several sectors of the economy, including the service industry. And it was established that there is low awareness. And it's worse in the service sector, like where we are now. The service sector has the least knowledge. I think manufacturing, because it has been associated with making of products for a very long time, since time immemorial, they have a higher level of knowledge and awareness about OSH. But it is not sufficient to prevent accidents. So we must be able to invest more of our efforts in creating awareness and building capacity of institutions, workplaces, and workers and even employers on how we can make our workplaces safe. On the issue of workers' health, it must be priority number one for all. Long time ago, I think when I started working, there used to be, whenever you go to hospital and you have said you are a civil servant, you will immediately access medical attention so that you can quickly go back to serve the nation. In Korea, we have workers' hospitals. So workers don't go to any other hospital. They go to workers' hospital. And all those people working in those workers' hospitals know that we are attending to workers who need to quickly go back and build the nation of Korea. We can do that in Kenya also. We can ensure that we prioritize the health of Kenyan workers so that you don't have to go to hospital, you have an injury, and you have to line up with other people who are not necessarily going back to work, but they are patients. But if you have a workers' hospital, it will be better and workers will be facilitated to get quick medical attention compared to other areas. So these are things that we need to prioritize. Then compliance is also low across the nation. And that is why the nation needs to invest in the technical personnel, the software. We need to train more OSH professionals so that they are able to provide the necessary support, advisories, services that are required by workplaces. And we ensure that all workplaces are able to access these services at one point or another. Of course, the costing must be reasonable also to ensure that as many workplaces as possible are able to access services. When the laws of occupational safety and health were enacted for the first time, the people who used to go to conduct workplace inspections were the clergy and honorary magistrates.
Really?
Yes. And they were doing this without pay.
I didn't know that.
They were doing this without pay more than 150 years ago. So they would walk to a workplace and just try to find out whether this workplace is complying with these legal requirements. No children working for more than 12 hours, because at that time children used to work for more than 12. So if we are able also to get people who can volunteer the work, and right now we have what do you call them? Those workers in the village. You remember the 100,000 volunteers or volunteer workers. They're supposed to be visiting villages and homes and houses in the village to ensure they check on the health of people. We can still have volunteers. We are never short of volunteers. And those volunteers can share information about how to make workplaces safe.
But is this information out there? Say, I wanted to volunteer.
Well,
what should be the procedure? Because I know
the problem right now would be that it is not provided by law. Secondly, we have so many people masquerading as occupational safety and health professionals. And number 3, enterprises are receiving visitors beyond their ability to cope. Every day you can receive even 10 visitors from different areas. Okay? So the enterprises that I have visited, they complain about, the number of visitors they receive. So if you had volunteers also, they might think that we are adding a whole list of people are going to disturb their workplaces.
Yeah.
But I can assure you, if it was something that was provided for in law, it would be very easy to implement. It's just like those who go for chanjo, vaccination and all that. They tell you about the chanjo they are going to give your child, isn't it?
Yeah.
And during COVID-19, they told you about COVID-19. So after that visit, what I mean is that after a visit by a volunteer or a safety professional or a government official responsible for safety, there is increased and enhanced awareness about that particular matter. So it's one way of increasing awareness. Then we also have the media. I strongly have a feeling that the media is not doing enough.
No, we are doing enough as
Really?
EHS Unplugged podcast.
Okay. But you see, the media's main purpose for existence are three. Number one is to inform. Number two is to educate. And number three is to entertain. This educate aspect, when you look at the entire media, I'm talking about the mainstream, the social and all this, is there a media organization apart from maybe EHS, which is focused on educating Kenyans on OSH or even WIP?
You know, it's an interesting question because personally, as EHS Unplugged podcast, people, one of the challenges I have is getting people to interact with the content, one. And the reason behind this is people say, what exactly is OSH? Why is it a priority area? Why should I care about OSH? And people forget that OSH is actually a human issue. Failure to invest in OSH means someone dying. Failure to invest in OSH means a business being closed down somewhere. But people don't look at it like that. And I love that you've mentioned that. If you look at mainstream media, there's no focus on OSH. And that also, if you look at, also brings us at the national level. We're also not doing enough to trickle down this information to the people that need it the most. Yeah. So we as a country, we are at fault. We have a long way to go. But it's good to note that there are people who are actually trying to get this information to where it needs to be with the people. Maybe in the next 5 years, you mentioned your vision. In the next 5 years, you told us you're going to see so much improvement when it comes to implementation of WIBA. So give us 5 years and you will see everywhere you go, instead of us talking about politics and politicians, we'll be talking about decent workplaces. We'll be talking about fair pay. We'll be talking about, investment in OSH. Are we focusing on the people or are we focusing on the profits? And if you're focusing on the profits, have we tied it to the health of the worker, the safety of the worker? Because those two go hand in hand.
Yeah.
So maybe let's give ourselves time, but it's true what you've mentioned about mainstream media. The content that they've curated, the content that they share with the public, we are not there yet. I feel like we've lost track.
Completely.
Yeah.
We really need to refocus the attention of the media towards OSH for the sake of national development. And there's something that I not mentioned, and this is important. Occupational safety and health at work is now a fundamental principle and right at work. From the 10th of June 2022, when the International Labour Conference resolved to include OSH as the fifth fundamental principle and right at work, it is now upon governments, countries, and member states to ensure that OSH is prioritized everywhere. And once it is a fundamental right, the International Labour Organization expects reporting on how far things are moving with respect to OSH. So this, we need to ensure that everybody in this country knows something about OSH and they can contribute to the development of OSH for the sake of our workers, for the sake of our employers. You know, when I saw there was a fatal accident 2 weeks ago where somebody dropped from, I don't know, I think it was the 9th floor. He dropped from the 9th floor and dropped down. And after that, even the employer, from the supervisors to everyone in the organizations, were in deep shock. So an incident like that, a fatal incident that is happening around lunchtime, will lead to the closure, temporary closure of that organization for the whole day. I mean, you cannot be having a body in your premises.
And you're working.
And you're working and everybody's happy laughing around. It doesn't work like that. Okay? So this brings me to the area of mental health in this country. And specifically for workers. People are troubled. There are many factors. But the workplace is becoming a major threat to mental health also. And employers and even employees themselves must be able to refocus their attention on how we can ensure that we have a mentally healthy workforce. So you remember I had mentioned about pre-employment medical examinations.
Yes.
Routine medical examinations and annual medical examinations. We need to ensure that mental health is fully incorporated. Mental health assessment is fully incorporated into the annual mental health checks for employees. And this should be for all workers. You know, some people say, me, I'm not a worker. I'm the head of this organization, or I am what in this organization. Those ones don't matter. What matters is your mental health. And it needs to be assessed as regularly as possible. There are many things now. The workplace has changed. I've told you about the robotics entering the work environment. People are already worried that their jobs will be lost. You remember when there was the introduction of the tea harvesting machines, somewhere in Kericho, the kind of uproar that resulted from there. So people are worried. There is anxiety. There are a number of workers who are depressed. Some of this is caused by the work environment. And those who supervise workers, and I mean all supervisory levels in this country, should be able to prioritize mental health for their employees. And including for the supervisors. Everyone requires an assessment so that should there be any issue with your mental health, it can be resolved before it worsens. Once it worsens and you start walking along the streets, very little can be done. So we need really to focus the entire nation on issues to do with mental health for workers. It's critical. It has entered a critical phase. And all of us must be able to look at it as one of the most important issues of our time.
Taking you back to WIBA.
Yes.
The focus is particularly on physical injuries.
No.
So you also cover, mental health injuries.
Yes. Yes.
Because I'm wondering how that would be, how you would assess that, the degree of injury, the level of injury.
We have several tools for assessing mental health. the WHO has a tool, and not one tool, several of them, to assess the level and the degree of mental incapacity. So the tools are available. I can't say that every tool is 100% perfect, but I can assure you the tools that have been released into the market are very crucial in identifying the degrees of mental incapacity. Yes.
But there's something we normally do before we dive into the episode. So one of the questions we ask is why you chose OSH as a profession. You could be doing anything. You could be farming in Sierra County.
Yeah.
But here you are practicing OSH. So why did you choose this path?
I don't know. I wanted to be a doctor.
Really?
I wanted to be a medical doctor, I think.
We are doctors if you look at the profession keenly.
But if you ask me now, maybe I don't want to be a doctor now. But I can assure you that I ended up here by accident. I also wanted to be a researcher, so I was looking for research jobs here and there after completing school. But when I did interview with the Public Service Commission, and they told me that I was going to be an occupational safety and health officer, I said, wow, this must be very close to medicine. So I plunged into this profession with all my energies, and I luckily also identified that in Kenya, for example, occupational safety and health research is virgin land.
That's true.
I mean, it is, and occupational safety and health is extremely wide as a profession. And therefore, I could do research from psychosocial hazards, physical hazards, mental hazards. I have done research on ergonomic hazards. And I still feel that I have just been scratching.
You're barely scratching the surface.
We are not even scratching it. I think we are outside OSH, but we are seeing so many areas that have gaps. The research in OSH in Kenya is not there yet. And we are hoping that when we develop the research strategy for occupational safety and health in the country, we should be able to focus everyone on the areas of research that we need to do. I am very keen on health of employees. I'm very keen. And I'm very keen also on stress at work and how it can be alleviated. But basically, my major area of concern is ergonomics, occupational ergonomics. And if you look at occupational ergonomics right now, it actually encompasses the backbone of occupational safety and health. Other than occupational safety and health risk assessment, occupational ergonomics is at the backbone of everything that we do and study in occupational safety and health. So I am really focused on that particular area right now. And I can tell you, I will not finish the work in OSH. It is extremely large and huge. And just like the Bible says, the workers are few. The researchers in OSH are extremely, in fact, the numbers are negligible. We don't have numbers.
In line with that comment, how would you rate the chairs you're sitting on right now?
These are designed for purpose.
Yeah.
And maybe probably we are not going to sit here for more than 2 hours. After that, we will be able to get up and go away. But I can assure you, these chairs are not, they're not bad. They're designed for purpose. And they can serve that purpose for the time that they're here. Yeah. But I can assure you, nothing cannot be improved.
Oh, that's true.
Yeah.
That's true. Thank you so much, Daktari. I've learned so much. WIBA is a very critical area, and it's information that people need, as you said. So thank you so much for coming on board to unpack, what you're doing with your department and the areas of support, right? So maybe just concluding comment. What do you have to share as we conclude this episode with our listeners and our people watching this episode?
Okay. First of all, I want to appreciate the invite to be able to share some of these insights with the rest of the world. Or I would want us to look at the plight of injured workers. We must have a fund to protect injured workers from the vagaries of economic problems that may arise. We need to ensure that we unite. Long time ago, if somebody had a problem, people used to come together to assist. Even if you die now, we will come together to bury you. If you are alive, we would come together, and you are sick, to make arrangements for your health care. As Kenyans, we must start thinking about how we can unite and assist those in need. And that's why we have talked about Workers' Compensation Fund. It will cushion them without antagonizing them with the employers. And this should be long-term cushioning. So for me, I see a country where people are united to fight and deal with occupational health hazard, to make our workplaces safe and our employees healthy. Maybe in future we'll be having an annual medical checkup where all workers have to be checked. All of them, not necessarily those in hazardous work. In any case, all workplaces are hazardous. So thank you very much for the invite once more.
Karibu sana. Thank you so much. We are looking forward to hosting you in the next 5 years, when your vision is being implemented, just to discuss the success stories. So thank you so much, Daktari.
Thank you.
So if you follow EHS Unplugged podcasts on all our social media platforms, if you've subscribed to our channel, I'm going to be calling you guys safety champions. So, safety champions, you've heard it from our guest today. One of the things he said that DOSH has invested hugely in technology. And we've seen that through their DOSHME's platform. Our guest has said the DOSHME's platform is now available to all members of the public. So even if you witness an accident, someone is injured, you can actually report that injury, and DOSH should be able to pick it up from there. So going forward, we should not be having complaints of someone saying, I got injured in the workplace and compensation was not initiated. It can be done from you. You do not have to wait for your employer to report an injury to DOSH. Take responsibility. Thank you so much, guys, for listening in. See you again next time. Bye.